Welcome again to our part 2 of cardiomyopathies. We have discussed previously the types of cardiomyopathies, their clinical presentation, the investigations needed, and how to manage these cases. In this part, we're going to talk about myocardial disease, which are systemic diseases that can affect the myocardium. There are specific cardiomyopathy or cardiomyopathies secondary to cardiac or systemic disorders. What are these systemic disorders? Muscular and neuromuscular disorders. Inflammatory conditions might lead to myocardial disease and later on cardiomyopathy. Metabolic disorders, systemic disease, sensitivity and toxic reaction, valvular cardiomyopathy, hypertensive cardiomyopathy, tachyarrhythmias, coronary abnormalities, and other disorders. On top of the list, you have the muscular and neuromuscular disorders. In the Duchenne muscular dystrophy, you're going to study it this year, and you're going to see patients with muscle disease, boys that cannot stand or walk early in life. It starts early in life. It is a secondary inability to walk, and these patients usually have cardiomyopathy. It is a common cause of death in this entity, and it has to be managed to delay the complications. So is Becker's muscular dystrophy, Friedreich's ataxia, myotonic dystrophy, and mitochondrial myopathies. All can be associated by cardiomyopathies. Infections as viruses come on top of the list of causes of myocarditis and myocardial disease. Coxsackie A and B, adenovirus and cytomegalovirus. Other viruses also can be incriminated. They can lead at the end to cardiomyopathy. Bacteria as diphtheria, TB, and typhoid are also affect the myocardium. So does the parasitic infestation, Toxoplasma and Toxocara, and fungi. Metabolic disorders like the endocrinal disorders, hypo and hyperthyroidism, both can lead to myocardial affection. And the infant of diabetic mother has got a hypertrophic cardiomyopathy. And this type of cardiomyopathy is the only one that is reversible, hypertrophic type of cardiomyopathy that is reversible. So when an infant of diabetic mother has got a hypertrophic cardiomyopathy, we follow him in the first months of life, and they improve in most of the cases. Nutritional disorders as beriberi, which is thiamine deficiency, leads to heart failure secondary to myocarditis and cardiomyopathic changes. So is kwashiorkor. Familial storage and infiltrations like the mucopolysaccharidosis, glycogen storage disease, and Pompe disease, these are inborn errors of metabolism in which there is an enzymatic deficiency that leads to accumulation of material in the tissues, and included in these tissues is the heart. When it is laid in the heart, it might lead to cardiomyopathy, myocarditis, or valve affection. Systemic disease also includes the connective tissue diseases like the systemic lupus erythematosus and rheumatoid arthritis. These are autoimmune diseases that affect the heart. The famous rheumatic fever can lead to myocarditis, and with the affected valve affection can progressively lead to cardiomyopathy. We used to see these cases in older days when patients with rheumatic fever had multivalvular lesions, and they died early in life during their teens from rheumatic carditis and rheumatic heart disease. Now it's a rare condition to be seen, the rheumatic cardiomyopathy. Infiltration like sarcoidosis, amyloidosis, and leukemias can affect the myocardium. The most famous in children is the leukemia, because leukemia is common in children, not sarcoidosis and amyloidosis. Amyloidosis takes years to develop. In leukemia, there is infiltration of the tissue in the tissues with leukemic cells, and this can affect the heart. Sensitivity and toxic reactions can occur due to anthracyclines, which are used in cancer therapy, irradiation, or iron overload. Iron overload as in cases of thalassemia. Sulfonamides and chloramphenicol can lead to hypersensitivity and cardiomyopathy. Other hypersensitivity reactions to other drugs, alcohol, and herbal remedies. Herbal remedies is used in some countries for treatment of ailments, and it might affect the heart. So be aware of some herbs that might affect the myocardial performance or other organs. These herbs are famous in areas in Africa. Valvular cardiomyopathy, in which the myocardium is affected due to a valve disease. For instance, if there is a tight aortic stenosis and it is not treated, the left ventricle becomes hypertrophied and then it stops. It cannot act anymore, pump blood anymore. So it starts to dilate and it enters into cardiomyopathy. Hypertensive cardiomyopathy, hypertension that is persistent and not treatable, might end into heart failure. Cardiomyopathy secondary to a tachyarrhythmia, a tachycardia that persistently affects the myocardium, and in children they cannot stand tachycardia, particularly infants, because their heart is already acting in a rapid way, beating rapidly, so a tachyarrhythmia might lead to a cardiomyopathy. Coronary abnormalities like the anomalous left coronary can lead to cardiomyopathy. That's a congenital anomaly. And the Kawasaki disease is an acquired infection that is not known actually what is the causative agent, and it leads to coronary aneurysms. Coronary aneurysms can lead to myocardial infarction or ischemia and cardiomyopathy. Other causes of cardiomyopathy include anemia. Chronic anemia can affect myocardial performance. Cardiomyopathy, sickle cell anemia, Loffler syndrome, that is the hypersensitivity, ischemia and hypoxia, like occurs in the neonate. Hypoxic ischemic encephalopathy or asphyxia can lead to a cardiomyopathy. Peripartum cardiomyopathy, this is cardiomyopathy that occurs around the time of labor and affects pregnant females. It is mentioned here because maybe an adolescent is pregnant. So please be ready with your questions in the next face-to-face session. These are references for you to read from. Kindly look them up, and thank you.